Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the basics of platelet-rich plasma therapy. PRP is a very exciting procedure. It uses one's own growth factors, platelets, and stem cells to help regenerate damaged tissue. Previously, it's been used for a long time in dentistry, urology, ophthalmology, along with other fields, and recently it's entered musculoskeletal medicine. The actual definition is a volume of plasma that has a platelet count above the baseline of whole blood. Regenerative medicine, which is what PRP therapy falls into, breaks the mold of conventional treatments. When you inject cortisone, also called steroid, it does work well for pain relief, but it doesn't regenerate anything. Okay, it's a proverbial band-aid, whereas regenerative treatments like PRP help to heal the actual problem. So what are the indications for PRP? Well, they're broad, and here's a few of them. Tennis elbow, golfer's elbow, rotator cuff tears or tendonitis, Achilles tendonitis, knee tendonitis, arthritis of the knee, shoulder, hip, etc., and also ligament injuries. Athletes are using PRP like crazy. It gets more and more popular every year. This includes Rafael Nadal, Tiger Woods, Kobe, plenty of the Dodgers, and one of the reasons is because it's not banned. How is PRP performed? Well, it really involves just 4 steps. The first is a blood draw, just like you would get at a lab, of 30 to 60 cc's. That's put into test tubes and then spun rapidly in what's called a centrifuge, and that's after about 15 minutes. You pull that out and you have 3 layers. You have the top layer, which is platelet poor plasma, the middle layer, which is what you want, which is PRP, and then the bottom layer is red blood cells. So what the doctor will do is aspirate the middle layer here, and that ends up being about 5 to 10 cc's, and the 4th step is it gets injected into the area of being treated. PRP therapy actually promotes inflammation, and that's the first part of healing. Therefore, you should stop nonsteroidal anti-inflammatories 5-7 days prior to the treatment. Professional sports leagues have not banned the use of PRP therapy. That's one of the reasons it's growing rapidly in usage for injuries. Initially, the World Anti-Doping Association did ban it, but as of years ago, they said there's lack of any current evidence concerning the use of these methods for purposes of performance enhancement. Well, what are the outcomes? There are more studies coming out, but so far we have some fairly small ones. Clinical Journal of Sports Medicine last year, a couple years ago, knee study in 22 patients. They had no change in arthritis and over 80% at 1 year with just 1 injection. Usually you get 2 to 3 injections, but this was just 1. Pain scores significantly decreased. Functional and clinical scores increased at 6 months and a year from baseline. There are some basic science studies showing that PRP treatment may improve healing in many tissues. We don't have the large clinical studies in humans. There was another study out of South Florida looking at PRP for tennis elbow in 30 patients. All 30 of these had failed all kinds of treatment, and they were basically looking at surgery. Over 90% of the patients were able to avoid the need for an operation with just 1 injection. More studies are needed to prove the effectiveness of PRP treatment and to research the best ways to standardize the treatment's preparation. Now, let's look at the risk-benefit ratio. It's your own blood, okay? It's an outpatient procedure. You do have some increased pain for 48 hours because it does spark up inflammation before it really starts to kick in with pain relief. Typically, it's a series of 2 to 3 injections that are not covered by insurance. And studies, as I showed, are showing excellent outcomes with just a slight downside. Very minor risk of infection. I mean, it's your own blood. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with very high success rates with the board-certified award-winning doctors. Keep in mind, PRP therapy is self-pay. It's not covered by insurance. Call us for more information at 844-2NJ-PAIN and look us out on the web at NewJerseyPainNetwork.com. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.